Hello, I'm Dr. Aarti Deenadayal from Mamata Fertility Hospital. I'm a gynecologist and fertility specialist. And today we are going to discuss about whether an IVF cycle can cause an ectopic pregnancy, which is a very commonly asked questions by our patients. So for this, let's first understand how does a natural pregnancy happen. Now, if you look at this model, this is a uterus, two tubes, and these are two ovaries. The ovaries produce the eggs are released inside the tube, and at this time, when the male partner has intercourse, sperm is deposited here. Now, the sperm climbs up into the uterus, into the tube, and then reaches the egg here. The baby or the embryo starts to develop within the tube here for 5 days. After 5 days, this baby then descends down into the uterus, holds on to the lining, and then continues to grow for 9 months. This means that this tube health is very, very important for a pregnancy which is forming over here to reach the uterus. So, if the tube health, the lining of the uterus, the lining of the tube, whether the tube is healthy or no, we do not know. So, if all this is in order, then a pregnancy will reach the uterus. So, this is how a natural pregnancy happens. Now, if you look at how an IVF conception happens, we are stimulating the ovaries to produce eggs. We are retrieving the eggs from the ovary. Then we are taking the male partner's sperm and we are injecting this sperm into the egg under a controlled lab environment and then growing the embryos. That is, we are culturing these embryos for 5 days in the lab under the ideal conditions. So we're basically observing how the babies are growing. Now, once the babies reach the final stage of development by the 5th day, what are we doing in an IVF cycle? We are then taking those embryos and loading them in this embryo transfer catheter and then transferring it into the uterus over here via this catheter, via the help of an ultrasound which is going to guide us where exactly to deposit these embryos. So this is about an IVF cycle. So what is the risk of an ectopic pregnancy in a natural conception? Now, what is an ectopic pregnancy? Ectopic pregnancy is when the pregnancy goes and gets stuck in the tube. That is, if at all this tube is unhealthy and a natural conception has happened, the pregnancy may get stuck here in the tube. Why is an ectopic pregnancy dangerous? Because if it gets stuck in the tube, this is not a normal place where the pregnancy grows. So this pregnancy, if it gets stuck in the tube, it may cause a tubal rupture to happen, and this is a very critical life-threatening situation for the woman. So we do not want this to happen. So in a natural pregnancy, when it happens, risk of ectopic is just 1 in 30,000. But if the woman has risk factors like a previous infection in the tube, if the tube is swollen, if the tube appears to be very unhealthy based on, say, an X-ray test which was done, or based on an ultrasound which was done, or based on a laparoscopy which was previously done, these are the patients where we say that they are at a higher risk of having an ectopic pregnancy. So this is about a natural conception. Now, what about an IVF conception? See, we are putting the embryos over here back into the uterus under ultrasound guidance. So the risk of ectopic is very, very low. It's about 2%. But an ectopic pregnancy can still happen in an IVF cycle. But this happens more often in women where maybe the uterus is having a more tendency for irritability, and even after we put the embryo inside the uterus is irritable and throws the embryo into the tube, and this is where an ectopic pregnancy can still happen in an IVF cycle. Now, again, an ectopic pregnancy in an IVF happens more often in women who have history of tubal disease in the past history, or a woman who have intrauterine adhesions. That means the lining of the uterus is stuck and which has been operated. But then if this condition, history of this condition is there, these patients are at a higher risk of having an ectopic pregnancy even in an IVF cycle. So this for you, my friends, is all you need to know about how a natural pregnancy happens. How is IVF done? What is an ectopic? Why are we worried about it? And what is the incidence of an ectopic pregnancy even in an IVF cycle? But then when we are doing the IVF cycle, we know that these risk factors, exist at the back of our mind. So we also take certain precautions to decrease this incidence of ectopic even in an IVF cycle. That is, embryo transfer has to be perfect. So the people who are doing, that is the doctors who are doing your embryo transfer, will use the best of technology so that the correct position of transfer can be found out and the embryo deposited at the right position. Also, we may use embryo glue, which is a substance just to decrease the incidence of an ectopic pregnancy. So this glue is used along with the embryo when it is being transferred, and we use this glue and deposit it in the right position under ultrasound guidance. Also, there are some studies which show that a frozen embryo transfer has a lesser incidence of ectopic pregnancy compared to a fresh embryo transfer. So this is basically the care which we take when we are doing an embryo transfer. And even after the IVF is done, 14 days later, when the patient comes to us for a pregnancy test, we do the pregnancy test and we follow up the patient very closely till we see the sac or the evidence of pregnancy within the uterus. So how is an ectopic detected? Again, it's based on suspicion, and in the initial stages when the baby is actually developing, we will not be able to see the pregnancy on ultrasound, and so we have to rely on the blood test, that is a beta HCG blood test, how it is increasing. So patient is followed up very closely, and till we see the pregnancy inside the uterus, we are not at peace. And yes, one more thing to note here is, in a IVF cycle, if there are two embryos which have been transferred, even if we see one sac within the uterus after a few days after the pregnancy test is positive, we still follow up the patient for a few more days, because there is a condition called heterotropic pregnancy. That is, one pregnancy sits inside the uterus and another embryo goes and sits inside the tube. So we are we are very aware of that condition as well. Though the incidence is very, very, very low, we always search for the presence of any ectopic pregnancy when we are doing the follow-up scans after the pregnancy test is positive. And what are the usual symptoms of an ectopic pregnancy? If the patient is having abdominal pain, which is progressively increasing, discomfort, spotting vaginally, bleeding vaginally, if they're having dizziness, these are some of the common signs of an ectopic pregnancy. But this usually happens when the pregnancy has advanced a little bit more. This is when the patient develops all these symptoms. So once the pregnancy test is positive in an IVF cycle, we always follow up the patient closely till we see the sac within the uterine cavity, and we also look for the number of sacs in the uterine cavity when we have transferred more than one embryo. And these patients, very, very rarely, of course, as I just mentioned, even in IVF, ectopic can happen, but then these patients are counseled that this can happen and they have to come for very frequent follow up. And if an ectopic pregnancy is diagnosed or is suspected, then the management is usually either a medical management where we give them medicines or some injections, or in the event that pregnancy is continuing to grow despite our medical management, that is when we suggest to the patient that they go in for a laparoscopic surgical removal of that particular ectopic pregnancy. Now, having said all this, I just want to give one word of caution to youngsters out there that, as I mentioned, risk of ectopic is always higher in those women who have a history of some sort of a previous infection. Now, this infection can be infection like tuberculosis, or it can be a sexually transmitted infection. So, in your younger days, you should be cautious. You should, if you are having, multiple sexual partners, you should be taking care. You should be protecting yourself from contracting these infections, because these infections have the potential to harm your future fertility and increase your risk of ectopic pregnancy, be it with a natural conception or be it even in a IVF cycle. So take care, and I really hope that this information was helpful to you. And if you are undergoing an IVF cycle presently, I wish you all the best for your IVF cycle, and wishing that you have a healthy Bonnie baby in your hands very soon.